directly, and we will be answering your questions at the end of the presentation. Okay, let me turn you over to our presenter for today, our VFC Quality Assurance Team Lead, Josephine Araki.
Good morning. Sorry, I just noticed that I wrote 2023 on the first page. It's actually January 30th, 2024. But good morning. Today we're going to talk about the vaccine management plan and the VFC Provider Agreement. So by the end of the presentation, attendees should be able to understand how to complete the VFC Provider Agreement and the vaccine management plan, as well as understand CDC call the shots post-test requirements. For the VFC Provider Agreement, it must be completed by new VFC providers upon enrollment, must be completed annually during the re-enrollment period. And the re-enrollment period, we generally send out the agreements the enrollment packet mid-November, and they are due by the end of January. So completed packets are due by January 31st of every year, which is tomorrow. All parts of the provider agreement must be completed. So this is the first page of the provider agreement. One thing we did want to highlight that all parts of the agreement need to be completed. And we want to note for the medical director or equivalent section, it must be signed by an MD, a DO, a PA, or an APRN-RX with current active license in good standing. We also need their NPI number to verify their specialty because the provider needs to be authorized to administer pediatric vaccines. And we ask that you enter the email address for the provider, as we do send updates and medical advisories and other information. And also we ask that there be separate email addresses preferable, one for the medical director, one for the primary coordinator, and one for the backup coordinator. We've noticed that some locations are just using one email address for everybody. We do request that there be a primary and backup coordinator. It's actually not a request, it's a requirement. And for VFC, the term vaccine is defined as any FDA authorized or licensed ACIP recommended product. So just for this page, want to note, please fill out everything. The next page are a list of providers. We ask that you list all licensed healthcare providers, MD, DOPA, APR, and RX, who have prescribing authority. And we need their license number to verify that their license is current and in good standing. And they need to be current, not expired. We've noticed that we've received some provider agreements where the provider's license is expiring January 31st. So please do take a note of that, as we may ask for an updated current license. The next page of the provider agreement just lists what the provider is agreeing to. We wanted to note that it is an annual agreement that needs to be submitted along with the provider profile, and that you're agreeing to screening patients and document eligibility at each immunization encounter for VFC eligible patients. And you're going to administer VFC vaccine to these VFC eligible patients, and that you're complying with immunization schedules, dosages, and contraindications that are established by the ACIP and included in the VFC program, unless the provider's medical judgment and in accordance with accepted medical practice, the provider deems such compliance to be inappropriate for the child, or the requirements contraindicate statement. And you're also agreeing to maintaining all records related to the VFC program for a minimum of 3 years, and upon request, make these records available for review. You're not going to charge an admin fee that is greater than $23.11. And for Medicaid children, you're agreeing to accept reimbursement for immunization administration set by the state Medicaid agency or the contracted Medicaid health tax. And not denying administration of a publicly purchased vaccine to an established patient because the parent cannot pay for the admin fee, and that you're going to distribute a viz for each time a vaccine is administered and maintain records of that. Also complying with the requirements for vaccine management, including ordering vaccine, maintaining appropriate vaccine inventories, not using a dorm style unit, and storing vaccine under proper storage conditions at all times. And if you have any spoiled or expired public vaccines, to return it to McKesson within 6 months of spoilage. We've noticed that there are returns of vaccines with an expiration date of years past. We appreciate that you still do return them, but in the agreement, you're agreeing to return it within 6 months of spoilage and expiration. I agree to operate within the VFC program in a manner intended to avoid fraud and abuse. Fraud is intentional deception or misrepresentation made by a person with the knowledge that the deception could result in unauthorized benefit to himself or some other persons. This could be an example of this is maybe charging for the vaccine when there should be no charge for vaccine, as providers receive the vaccines for free. I'll participate in VFC program compliance site visits, including unannounced visits and other educational opportunities associated with VFC program requirements. So compliance visits are required. We can conduct them anywhere from 13 to 24 months. We'll try to work with your schedule to make sure that you can accommodate us. We know that you are busy with patients. The educational opportunity discussed in this, our requirement is that you complete the You Call the Shots, modules 10 and 16 annually, and submit your certificates with your enrollment packet. So as the provider signing, they understand that participation in Hawaii Immunization Registry is required for VFC ordering, inventory reporting, and distribution. So we do not accept paper orders anymore for most vaccines. You will need to place your order in HIR. And you also understand that your location or the DOH may terminate this agreement at any time. And if you choose to terminate this agreement, you'll return any vaccine, any VFC vaccine to the Department of Health. And also the medical director, by signing the form, is certifying on behalf of themselves and all immunization providers in that facility that they've read and agreed to the vaccines for children enrollment requirements listed in the provider agreement, and that they'll be held accountable. This next page is just an additional page to list more providers. As I mentioned, for each provider, please list their license number and preferably their NPI number. If you don't have it, that's fine. But for the medical director, we do require the NPI number. The next few pages are the provider profile. One thing I did want to note, if you receive the digital version, you can click on the blue underlined links and it will pop up to more information. In the provider type, we do ask that you list not qualified. You must choose one of these types, and there's a list with definitions if you do have questions of what type it is. More information on different types of providers. We did want to note for specialty providers on this list, it lists family medicine, internal medicine, OBGYN, pediatrics, and preventative medicine. The only specialty provider on this list is an OBGYN provider. Pediatrics is not considered a specialty. This page, the next page of the provider profile, we've noticed that providers have been marking yes or no. If they're marking no, that they are not a specialty provider, they are still going ahead and marking vaccines here. And that's incorrect. If you click no, then you must check all ACIP recommended vaccines for children 0 through 18 years of age. Most providers are not specialty providers, so and must check this box here. For specialty providers, examples of that, as I'd mentioned, was the OBGYN clinic. Also, that would be birthing hospitals, pharmacies, school-based health clinics, those type of locations. As I mentioned before, pediatricians are not considered specialty providers by the VFC program. Only check these vaccines if you're a specialty provider. The next page is if you are a new provider and you are not sure about the number of patients that will be vaccinated that qualify for each category, we ask that you give an estimate. For re-enrolling providers, we ask that you give the numbers that you actually vaccinate. These numbers here, if you have the fillable portion, they do say 0. It doesn't mean that we don't want you to fill it out. They just have formulas in here, so when you plug in your numbers, it'll calculate totals for you. So please disregard the zeros and input your numbers. Now we're going to the vaccine management plan. This one has a lot of pages, and we do have some corrections that need to be made. So for this first page of the vaccine management plan, it should be reviewed every year. We've gone to some sites where we've noticed they haven't reviewed their vaccine management plan for a few years. It needs to be reviewed annually and signed and dated. And this template that we have that the state provides meets VFC program requirements. I do understand that your facility may have your own vaccine management plan, but if you complete this vaccine management plan and submit it, it will meet all CDC and OA VFC program requirements. Just an example, date, name and title. If you don't have a title, that's fine, and sign. We do understand that some coordinators don't have designations. The next page just includes your contact information, who to contact in case of an emergency. I did want to note here that you need to designate at least one primary and one coordinator. They're responsible for managing the VFC vaccine, and both primary and backup should be equally knowledgeable about vaccine management. So the backup person should be able to do everything that the primary coordinator does. When the primary coordinator or backup is replaced, please notify us at oavfc@doh.voa.gov. The next page, the links here are all clickable, as I mentioned before, and there's very useful information. You can access the CDC Vaccine Storage and Handling Toolkit, as well as the vaccines. The links here that we have for you call the shots are incorrect. We need to update them. CDC as of January 1st went from TCEO, which was their former education website, to CDC Train. So I have the links here for links for you to go and create a CDC Train account, as well as access modules 2016. We did have a webinar last week on CDC Train, so I highly recommend you go to our website. I did list the website in the link in our chat for you to access, and you can go back and do it. So the primary and backup coordinators are required to complete the all the shots models N16 annually. It's not required for all other staff, but we do recommend that other staff members who receive vaccine deliveries or handle, prepare, or administer should be trained in these modules as well. The next page is just a document for you to notate who took the modules, what data was completed. This page here talks more about vaccine ordering. So VFC vaccine providers must submit orders for routine VFC vaccines via HIR, as I mentioned before. If you have any issues with HIR, we do have the information in the vaccine management plan, or you can email them at registryhelp@doh.oa.gov. So the only orders that you do place in HIR when you submit paper order are for seasonal and or allocated products with limited availability. So that would be the nirsevimab, COVID-19, or flu vaccines. And we encourage you to submit your orders by the 15th of every month. At most, you can order 1 to 2 months supply. And you're required to have, before you can place an order, you're required to have your current VFC program enrollment, submit your VFC vaccine administration visit records, the vouchers, or submit VFC vaccine administration data to the Hawaii Immunization Registry within the last 6 months. And you can contact HIR through that registry help at doh.hawaii.gov, or us if you would be interested in doing a data quality check to see if you can discontinue using the paper vouchers. You also need to report doses used since last inventory and the number of doses currently on hand via HIR, and report the number of vaccine doses used since the item was last ordered. Vaccine usage must be reported to provide necessary justification for fulfillment of the vaccine requests. And submit preferably through email, your refrigerated freezer and ultra cold freezer temp logs for all units that cause VFC vaccine. And we ask that you submit them every month, even if you're not placing an order. The next, we're going to be talking about shipping and receiving procedures in the vaccine management plan. Receipt of vaccines. Providers should never refuse vaccine shipments under any circumstances, including delivery after provider hours. Like if you suspect that they're warm or spoiled or damage to the exterior package. If there's damage to the exterior package, be sure to take photos of everything to document. So when you receive your shipments, open the vaccine shipments immediately, check the temperature monitoring reading, inspect the vaccine, and compare the vaccine you receive with the vaccine products indicated on the packing list, and you store it at appropriate temperature. If you think that it's experienced a temp excursion or there's any compromise to vaccine viability, keep them separate and label you can either package them and label them do not use and store at appropriate temperatures and go through the temp excursion process. Now, shipments from McKesson, VFC providers must contact McKesson directly on the same day that delivery has occurred to report if you've had an excursion or if you question that the vaccine viability has been compromised. You can give them a call at 1-877-836-7123. And you must leave a detailed voice message at the number if reporting a shipping incident to McKesson after 8 p.m. Eastern Time. And please state your name, contact phone number, your VFC provider PIN, delivery number from the packing slip, and what the issue is. They're probably going to ask you, as I mentioned before, for photos. So please take photos of the container, packaging, activated warm freezer monitors, and avoid disposal of shipping boxes, packaging, packing slips, and temperature monitors until you resolve the issue. and also let us know. So shipments from Merck for frozen vaccines, return replacement instructions are included in all the shipments, and you want to contact them directly at cdcshipping.merck.com to report any shipment issues and arrange for vaccine return replacement. Note for frozen vaccine shipments, diluent is located in the lidded compartment of the shipping box. And we're going to talk about variants. Merck varicella vaccine shipments no longer include temp indicators. Viability is determined by assessing shipment transit time. So providers will need to take a look at your packing slip to identify the shipment date. For ProQuad, orders are viable for 1 day, regardless of shipping container size. ProQuad shipments may include a temp monitoring device. Shipments from Pfizer, you contact Pfizer customer service at 1-800-666-7248, option 8, or you can email them at that email address, cvgovernment@pfizer.com, to report shipment delivery issues. Now, if you have any delivery issues from us, from the vaccine supply and distribution section, business will ship the following vaccines biologics to providers on the Navy Islands, so HVA, and also vaccines biologics requested in response to a disaster outbreak. On inspect the temp monitors, and if any have activated, take photos of the monitors, contact us to report the incident. And this staff will work with you to determine if the vaccine is viable. So overshipments, where you receive more than you ordered, or misshipment, where you receive at least one vaccine that was not ordered by the provider. So if in the above listed situation, keep the additional vaccine and use it. If it's not possible, you should transfer it to another VFC provider later. Now, transporting vaccine. So vaccines from your supply should not be routinely transported. If you have different locations to preserve cold chain, you should be ordering your vaccine to be delivered at that other location instead of having one place and then transporting the vaccine. There's just more of a risk for breaking the cold chain if you do that. Vaccine should only be transported using appropriate packing materials that provide the maximum protection. The total transport time alone or transport plus clinic workday should be a maximum of 8 hours. Your facility should have a sufficient supply of materials needed for vaccine transport of your largest inventory. So not required but preferred is a portable vaccine refrigerator or freezer unit, qualified container packed out, or a hard-sided insulated container or styrofoam. We understand that it could be cost prohibitive to get a portable vaccine or qualified packed out. So it is acceptable for you to have a cooler with cardboard and bubble wrap, and also a DDL for transport. You could also use cooling materials such as phase change materials or frozen water bottles that can be conditioned to 4 degrees Celsius to 5 degrees Celsius. Insulating materials, as I mentioned, such as bubble wrap and corrugated cardboard, enough to form 2 layers per container, and a DDL. We want to note, don't use dry ice, even for temporary storage. Dry ice might expose the vaccines to temperatures that are colder than -50 degrees Celsius. The only exception to this is for transport of COVID-19 vaccine, as they do tolerate ultra cold temperatures. Use a continuous temperature monitoring device, as I mentioned, a DDL, and your vaccine packing procedure for your refrigerated temps would be line the bottom of the cooler with conditioned water bottles. Place 1-inch layer of bubble wrap over the water bottles. Place vaccines and thermometer probe over the bubble wrap layer, and place another 1-inch layer of bubble wrap over the vaccine. Place the conditioned water bottles over the top layer of bubble wrap. Close and secure the cooler. You also do want to make sure that you have your probe, your DDL probe in there with your vaccine. Temperature monitoring. Temperature monitoring should be the primary responsibility of the provider or the provider's vaccine coordinator. If other staff must monitor temperatures, they should be trained on how to respond to and document actions taken when temperatures are outside the appropriate range. And also how to appropriately fill out the temperature logs. We did have another webinar discussing temperature logs. If you go to our website, you can find the webinar there. Post a temperature log on the vaccine storage unit door or nearby. That's readily accessible and visible. Record refrigerator, freezer, and ultra cold freezer temps twice each day, beginning and end. So for refrigerator, it should be between 2 and 8 degrees Celsius. Freezers between -15 and 15 degrees Celsius. And ultra cold freezers between -9 and -60 degrees Celsius at all times. Twice daily temperature monitoring and reporting is required, even if you have a continuous monitoring DDL. Take immediate action to correct improper vaccine storage conditions. If you have a temp excursion, and document actions taken on troubleshooting record page of the temp log. We will be having another webinar within maybe the next few weeks discussing how to handle temp excursions. And we ask that you maintain an ongoing file of temp logs and store completed logs for 3 years. Oh, I did want to note, and it wasn't listed here, that you also need to take your min-max temperatures at least once per day. Storage units for vaccines. Standalone refrigerators and freezers are recommended. I did want to note that starting July of 2024, if you do have a combination unit, we are going to ask that you purchase a standalone freezer. We've noticed that a lot of the combination units are experiencing temperature excursions, so it will be a requirement that you purchase a separate standalone freezer. As use of such the combination units is discouraged due to documented problems managing frozen and refrigerated vaccine. What's never allowed are dormitory or bar style refrigerators. So providers enrolled after July 21st, 2024, actually this will be for all providers, will not be allowed to use the freezer compartment or also combination unit. For your refrigerators, vaccine should not be stored in the door, in the bottom, or of your bins. They should be 2 to 3 inches from the walls and back with space for airflow. They should be placed on the floor and a bin. And there should be enough room to accommodate the largest inventory and be removed without overcrowding. We've noticed as we've been to some sites that there are a lot of vaccines that are packed in the unit and that can affect the temperatures. And that's the vaccine viability. If you are going to have any medications and biologics stored with the vaccine, they should be placed below the vaccine on a separate shelf to prevent possible contamination. We talked about standalone freezers being required after July 2024. Studies have shown that the freezer and the combination unit is unreliable for keeping frozen vaccine at the proper temperatures, which is the -15 to -15 degrees Celsius. So store your food and beverages in a separate storage unit, not with the vaccines. Water bottles marked "do not drink" should be placed in the refrigerator as a thermal buffer to help protect the vaccine from temp variations. Place them in the door, on the floor, against the back and walls if possible. And the same should be done in freezer. A do not disconnect notice must be posted next to every outlet where a vaccine freezer or refrigerator is plugged in. And a second do not disconnect sticker must be at your circuit breaker. Prior to use of your vaccine, the storage unit should be inspected by the immunization program staff and have at least 5 days of consecutive immunization. So that would be if you're getting a new storage unit, we ask that you send us 5 days worth of temperatures so that we know that the unit is in range. And let us know what type of unit it is so that we know that it is not a household or a combination unit. Sorry, I stand to be corrected. It's not Household is okay as long as it's not a combo unit. Also, pharmaceutical grade units may not require water bottles. Check with your manufacturer for guidance. Storage and handling practices. As part of the VFC Provider Agreement, providers are required to store and handle all vaccines under proper conditions, including always maintaining cold chain conditions and chain of custody, as we talked about. Always monitor vaccine storage unit temperatures at all times using equipment and practices that comply with the DOH, and return all spoiled expired vaccines within 6 weeks. And you're going to comply with Hawaii Immunization Program guidelines for dealing with quick excursions. Store vaccines that require refrigeration in the middle of the refrigerator compartment, away from the coils, walls, floor, cold air vent. Store vaccines that require freezer storage in the middle of the freezer compartment. Store a vaccine with enough space to allow for cold air circulation around the vaccine, and never store vaccines in the dwelling storage. Vaccine inventory management. We monitor expiration dates weekly and rotate stock as needed, follow a first in, first out strategy, or actually want to have those that are expiring first in the front. If nearing expiration, check posted manufacturer information for the most up-to-date expiration extension. With some of the COVID vaccines, they do allow for extension, so I would check with the manufacturer. And if you have any expired vaccines, please do not leave them in the storage unit. Please take them out and bag them and label them expired vaccine. If expired vaccine is administered, it's considered a vaccine admin error. You'll need to report to VAVRs, and most likely will have to revaccinate. Administering, an expired vaccine may or may not require revaccination based on the manufacturer's guidelines. And you must have a written procedure for vaccine management. That includes an inventory control procedure. Now, this page 15, we notice that a lot of people are forgetting to include this section here. Just to let us know when a physical inventory of your VFC vaccines is conducted. For example, if you do it every 1st of the month, 15th of the month, or the end of the month, please write the specific date of the month. You should do a physical inventory of your vaccines at least monthly. Temp logs for the previous 30-day period for all units that store VFC vaccine should be sent to us monthly, as I mentioned before. Please do not skip months and send us 3 months in a row with your order. We ask that you send your temp logs monthly, even without it. The inventory is conducted to ensure that you have the shortest expiration date used first. The inventory is stocked and rotated, and VFC vaccines are kept separate from privately purchased vaccine and are easily identified as such. Short-dated vaccines, I know this is not always feasible, but if you notice that you have vaccines that are going to expire soon, please try to find another VFC provider that you can distribute them to. Unfortunately, we do not do the transfers. It would be something that you would have to do yourself. And if you have any spoiled or wasted or expired vaccine, please report it in the vaccine loss reporting form, which can be done on HIR. Expired, spoiled, and wasted vaccines. Non-viable vaccine is any vaccine that is unopened that can't be used because it has either expired or been spoiled due to exposure to out-of-range types. So you want to take that vaccine out of the unit, place it in a box labeled spoiled, do not use, or expired, do not use. And all expired and spoiled vaccine must be reported. As I mentioned, you complete the loss reporting form. We prefer that you do it through HIR. Currently, we will take the loss reporting form through fax or email, but our goal is to have everything done through HIR in the future. We'll review the return, and then you should be getting a label in your email to whoever's the primary coordinator listed, and it will It may not be an obvious email, it may just be an email from UPS. So upon receiving the shipping label, ship the vaccine in a box to McKesson within 6 months. Wasted vaccine is vaccine that has been opened but not used. And the same thing with the wasted as the spoiled vaccine, please report it. Emergency procedures. You should make plans to prepare for emergencies. You must have written procedures for vaccine management that include emergency vaccine storage plans. So we do have some templates. It says here 3, but we have added one. Since you only need to fill out one, you don't have to fill out all of these templates, just whatever is applicable to you. You can fill out more than one if you have more than one type. So the first template is for template for transport to another location that is a professional facility. That would be if you're sending your vaccine to a pharmacy, or if you have another provider that you work with that has a storage unit that you can store your vaccine in, if you have any issues with your storage units. The next template is for transport to another location. A lot of times providers will take their vaccines home or to a staff member's home if they don't have an alternate location. So this is the template that you would fill out for this situation. If you have an emergency generator within your facility, this would be the template that you would fill out. And this is a new option that we provided for providers. You can use a phase change material cooler. So these are coolers that are specifically made for this, for storage of vaccine. And if left unopened, I believe the refrigerated ones can keep them at temps for a few days. I'm not sure exactly how long. It would be based on the specific storage unit and the manufacturer. So, but it is a new option. I discussed CDC Train. That is the new, we had our webinar this week on CDC Train. I just want to give a reminder that the post-test for the You Call the Shots modules can only be taken twice. If you've taken it twice and you haven't passed twice, please contact us because it won't allow you to retake it until the next year. Just a reminder that enrollment is due by tomorrow. Enrollment packets were mailed November 13. If you didn't receive it or are unable to locate your enrollment packet, please call the Hawaii Vaccines for Children program. Our number is 808-586-8300. If you are a neighbor island provider, the number is 1-800-933-4832, or you can email us at hawaiivfc@doh.hawaii.gov. Completed forms may be submitted via email to hawaiivfc@doh.hawaii.gov. This is our preferred method. If you do email us in the subject line, we request that you write your provider location name, your PIN number, and that it would be, you can title it enrollment packet. You can fax it to 808-586-8302 or mail it to Hawaii Department of Health, Attention Vaccines for Children Program, PO Box 3378, Honolulu, Hawaii 96801. For more information about the 2024 VFC enrollment requirements, please view the webinar. We did one in December, so you can go to the link in the chat and click for it there as well. Here is our contact info for HIR and us, our team here. I am Josephine Araki. If you'd like to contact me, or you can feel free to contact any one of our quality assurance assessors. Any questions? Sorry, that was a lot of info. We will be online at this meeting time until, let's see, 10 a.m. It looks like Kealohi will be submitting our link. please fill out this post-webinar survey. We wanted your thoughts on how we're doing, or if there are any topics that you want us to discuss, or is there a better time that you would prefer? We would appreciate if you could fill it out. And if nobody has any other questions, that's it for our webinar for today on the VFC Provider Agreement and the Vaccine Management Plan.